Meet Celeste, an adventurous occupational therapist with a passion for the outdoors. Celeste never imagined a skiing accident would disrupt her active lifestyle. After tearing her ACL, she wanted a treatment that aligned with her holistic approach to health. While researching options, she discovered the BEAR Implant, a procedure that could help her regrow her ACL. That's when she found Dr. Michael Greller of AOSMI, an orthopedic surgeon who performs the BEAR Implant and is the first to have brought the BEAR Implant to Monmouth County. Choosing this innovative approach was a risk that Celeste felt was worth taking. Celeste not only recovered, she found herself living even fuller than before. This is her story.
I am Celeste Grombacher. I am a patient of Dr. Greller's.
Celeste was a patient of mine who traveled here from over 2 hours away, and she was seeking treatment that was different than the standard ACL reconstruction. She found me because I was doing something called the BEAR, which is basically helping the patient regrow their own ACL.
I had torn my ACL skiing. I was coming down. I heard a pop. I just thought it was a minor injury until I went to stand up and my quad didn't work in my knee. And there's studies out there that within 2 hours of your ACL being torn, there is no more messages going from the brain there or back. It's like it's gone. I have no pain, but it's not working right. And started driving home, and it was my right knee for the gas pedal. And I just really processed the experience. If I did something wrong, I'm getting it fixed. I started the journey and found out about the BEAR implant and started looking for doctors and found Dr. Greller. In my area, there were 3 doctors, but when I met Dr. Greller, on instant, he said the right things.
The BEAR is where you take the patient's ligament and reattach it and then put some collagen into there to get it to heal. It's a newer procedure that's been developed in the last few years, developed on technology on how the medial collateral ligament heals. So when Celeste sought me out, I told her, I don't do it on every patient. I have a certain criteria they need to meet, and if she met the criteria, we would proceed with a surgical intervention. Even at surgery, there's always a chance that it would not be what she wanted, but I would do my best to get her what she liked.
And he impressed me so when he said, so you get to pick. You can use your quad, you can use your hamstring, you can use a patellar ligament, you can use a donor.
You're regrowing your own ligament, so it feels like a normal knee.
So he was speaking my language right from the get-go and was not in a rush, gave me every bit of time that I needed. He spoke kindly, fully, he was passionate. And I know as a healthcare provider, when someone is truly invested in the patient and what they do, the difference that makes in your outcome. What things won't I be able to do if I don't get this fit? Well, I ski. Well, you couldn't do that. I said, okay, well, I said, I do yoga. Well, you may be able to do that. I said, well, I play golf. He goes, yeah, you righty or lefty? Or righty? He goes, that's questionable. And I said, and I dance. He goes, well, what kind of dancing do you do? I said, I'm a deadhead. If you're asking what kind of dancing, there is no what to that. I have to get it repaired. Have to represent what it is that I live by. I couldn't lay my head down on my own pillow if I wouldn't have done something to change this. Using the BEAR implant is repairing your ACL, whereas using a hamstring or a quad or a patellar ligament is reconstructing it. I didn't really have concerns about rejection or any of those sorts of things. I have never had a surgery, so this was a whole new experience. The experience was very different in the grogginess and such. I didn't feel pain or anything. I was thrilled because Dr. Greller had placed the BEAR on my belly, and he went out and told my boys and my dad and said, she's going to be really happy when she wakes up because she's going to find out she did get the BEAR implant.
So she went through the surgery, she got the BEAR, and she did everything that she needed to do post-operatively. She rehabbed over in Pennsylvania. and she met every goal along the way.
Afterwards, they had PT come in and they had me stand up. I was still pretty much out of it, but was able to do what they needed me to do. I really feel that doing the walker for the first week or two was ideal, and so I was glad that they brought that in. As my range of motion changed, that's when I could notice a difference. First one is from hip to ankle, and it's very heavy. So that changes your body mechanics, how you're moving. Once I got to the second brace, which was much less restrictive and didn't limit how much range I have as much, I could continue to see the progress and the change. By the time I got to the third brace, I felt like I was fully recovered.
She had desired goals, and she wanted to get back to skiing, which was very important to her, and her active lifestyle.
So when you ask how long till my strength came back, so that was May, June, July, 3 months. Then I went and I would wear my brace and I went out lightly dancing. And it was actually February 4th that I went to the local mountain and I skied and only stayed on the bunny slope just to feel it out. That was almost to the date from May, 9 months. You're not supposed to be recovered for 15 months.
She was skiing downhill without telling me, but she was doing everything and got back to her lifestyle that she had become accustomed to, and her knee felt like a normal knee.
When he walked in, I was sitting on the edge of the treatment table like this, and he was like, "Oh my God, what are you doing?" And I was showing him I have full flexion in my leg. I can squat completely. After the surgery, when he saw me, I would say, "How soon can I put castor oil packs on? How soon can I get in the Epsom salt?" And I used essential oils. For years, I've used homeopathic remedies. I believe that I didn't have any further trauma because I've had so much myofascial release, because my body's very clean and pure, because I eat natural, because I take homeopathic remedies, because I do everything outside of the box. I take vitamins and supplements. I would take Ruta 1M at PM and Arnica 1M AM, and I did that alternating every day. I never took any painkillers throughout the process and after the surgery. He accepted everything that I was doing. I got off the lift out in California just like I always do. I didn't look at a trail map. I was in the ski bowls of California, got off the lift, and it's all black diamonds, and I skied down. And I took a picture of me up there. I was like my first run down. And then I skied the rest of the trip, 14 days in a row. And a lot of people are like, and even my son was like, "Are you tired? Aren't you ready to go home?" I said, "No, let's hit another mountain. I'm ready to go more." I would tell anybody to make sure your body is ready to receive and that you're aligned. And Dr. Greller is someone I believe anyone can align with.
So this is just where orthopedics is going. It's not only what patients want, it's what the doctors want too. So I look forward to an exciting future with more patients like Celeste.
The surgery does mean it's a journey. It does mean it's a commitment, but it's a commitment worth making. If you feel that in life you want to continue to live the fullness that you had known, and you may find that you end up living fuller.